Type 2 diabetes is a problem in how the body controls and utilizes sugar, glucose, as fuel. This chronic disease results in too much sugar distributed in the bloodstream. Eventually, high blood sugar levels can eventually lead to circulatory, nervous, and immune conditions. Stay tuned to parshealthtv to know the actual cause of this life-threatening disease. In type 2 diabetes, there are mainly two interrelated issues at work. Your pancreas does not make enough insulin, a hormone that controls the movement of sugar into your body cells. Cells react poorly to insulin and take in less sugar. Type 2 diabetes used to be famous as adult-onset diabetes. Still, both type 1 and type 2 diabetes can start during childhood and adulthood. Type 2 is more expected in older adults. Still, the raised number of children with obesity has led to more cases of type 2 diabetes in younger individuals. There's no cure for type 2 diabetes, but losing weight, dieting well, and exercising can help you control the disease. If diet and exercise aren't enough to handle your blood sugar, you may also require diabetes medications or insulin therapy. Different types of diabetes. There are different kinds of diabetes, each with special treatment and causes. Type 1 diabetes. This kind of diabetes happens when the immune system, which is responsible for combating infection, attacks and destroys insulin. So, this type of diabetes is an autoimmune system disease, which means the body attacks itself. In this case, the cells that make insulin or the insulin produced by pancreas cells are eliminated. Among the individuals who have diabetes, 10% have type 1 diabetes. It is primarily diagnosed in children and young individuals, and because of this, it is known as juvenile diabetes. This type is insulin-dependent diabetes because patients need to take insulin daily. Type 2 diabetes. This type of diabetes happens when the body is resistant to insulin. With this type, the body cannot make enough insulin, or your cells cannot use it. This is a disorder in that liver and fat cells cannot utilize insulin, so the body requires more insulin to break down glucose for entering the cells. Diabetes type 2 is the most common type of it. About 90% of people who have diabetes have this type. Individuals with type 2 diabetes usually are middle-aged and older people. Because of this, it is also called adult-onset or insulin-resistant diabetes. Prediabetes. This is a phase before type 2 diabetes when the blood sugar is more than what it should typically be but not that high to be regarded as type 2 diabetes. You can have only a high blood sugar level, not the other signs of diabetes. This type of diabetes is treatable by medical procedures and can last for a few months or years. Patients with prediabetes are primarily around the age of 20 and older. You can prevent this type with a healthy lifestyle and some medication. If you neglect it, it develops into type 2 diabetes. Before we talk about the actual cause of type 2 diabetes, don't forget to subscribe to our channel and hit the notification bell to get more informative videos. Actual cause of diabetes. Type 2 diabetes is actually the result of two interrelated issues. Cells in muscle, fat, and the liver become resistant to insulin. Because the cells don't interact in a healthy way with insulin, they don't take in enough sugar, and blood sugar levels rise. Also, when the pancreas is unable to make enough insulin to control blood sugar levels. This problem happens because patients have excessive fat in their liver and pancreas, so being overweight and inactive are the most important contributing factors. Other causes of type 2 diabetes. The exact reason for it is unknown. Scientists believe that these factors can boost the risk of getting it. Family history. Having a parent or sibling with diabetes can raise your risk. Obesity. Suppose you have extra weight and you are physically inactive. In that case, you are more likely to develop type 2 diabetes because the excess weight may cause insulin resistance. It is essential where your fat is stored. Belly fat is mainly linked with insulin resistance. Cardiovascular disease. Having high blood pressure or a history of heart diseases in you and your family, and smoking. Hormonal diseases. Although the actual reason for diabetes is not apparent to anyone, all of these environmental aspects can impact the risk of getting it. The hormonal condition can also cause diabetes because when the body makes too much of a specific hormone, its side effects are insulin resistance. Medicines. Some drugs impair the body's beta cells which are responsible for making insulin, like anti-seizure medicines, psychiatric medications, anti-rejection medicines, and statin. Statins that can save you from heart diseases and heart attacks reduce bad cholesterol levels and slowly develop your insulin resistance. Diabetes symptoms. Some symptoms are common in all kinds of diabetes, such as feeling thirsty, unusual weight loss, boosted hunger, unexplained numbness in feet or hands, frequent use of the toilet, particularly at night, and blurry vision. Tiredness, fatigue, and slow healing of sores are other signs of diabetes. But it is very dependent on how high your blood sugar is. In type 1 diabetes, these signs are severe and show themselves fast, like several weeks. But type 2 diabetes can develop very slowly, maybe for several years. The scary fact about it is that it is silent. You may not notice until it becomes developed and dangerous. All types of diabetes are dangerous and life-threatening conditions. If you neglect your signs and your diabetes develops into a severe illness, it will cause lots of serious issues for your health. Most diabetes types do not have so many symptoms, so take a blood test twice a year and check your health. Please share your experiences with diabetes and its signs with us in the comment section below. If you enjoyed the video, like it, and please share it with your friends. Have a great day.